optimum protection. So what is Ontario doing? Can people get their kids a second dose 3 weeks later if they really want to, or do they need to wait 8 weeks?
We're following the 8-week protocol. That's what Dr. Moore recommends, and that's what we're going to be following for children 5 to 11.
Can you clarify, are we getting 2 shipments of doses then, and how much is in each shipment?
Yes, I believe the shipment for today is about a little over 400,000, and then there's a shipment of a little over 600,000 coming in.
And are the doses being allocated on a per capita basis to PHUs, or some being directed to areas of lower vaccination rate overall? How is it being distributed?
It would be distributed according to the distribution of children in certain areas, and then it's going to be distributed at a certain rate based on some goes to public health units, some goes to primary care, some will go to pharmacies, of course. Pharmacies are going to continue to be great partners with us, but we certainly know that parents of younger children, 5 to 7-year-olds, would prefer to have their child vaccinated at their pediatrician's office or primary care family doctor, but for older children they're okay if they're vaccinated in pharmacies and mass vaccination clinics as well. But we know that that's going to be important for parents to be there. A lot of parents still have some concerns and still want more information about the vaccines for younger children. And we do have a relationship with Sick Kids Hospital that you probably know about, that if parents want to speak with someone, they can certainly call the Provincial Vaccine Contact Center at it's 1-833-943-3900, or they can make an appointment to speak to someone at Sick Kids at sickkids.ca/vaccine consult. So that, I think it's natural that parents would have questions, and so we want to provide them with the resources that they need in order to make a decision for their child.
What is your message to parents who think, who have heard maybe kids are at lower risk of getting COVID? Why do I really need to give them this vaccine?
Well, unfortunately, we know right now that a third of the new cases of COVID are in school-age children. So I think that speaks to the need to get children vaccinated as it's being as important as adults being vaccinated.
Some pharmacies, as we know, are now going to be doing COVID testing for symptomatic people. Will those pharmacies also be offering vaccines to children at the same time?
Yes, some of them will be, some of them won't be. It really just depends on the configuration of the pharmacy, whether they're able to have a way for symptomatic people to come in separately. So if you're symptomatic, you're not going to come in and do your shopping and then go and have a test. It's going to be important that they have a way to keep people apart, so that if you are symptomatic, you can come in and have a test and then leave. Or you can send someone else in for you to pick up the test, do the test at home, and then have someone deliver it back for you. So safety is the utmost concern in pharmacies, and as I said, not everyone will be able to do both.
Are you confident? Questions? Sorry. Okay, is there anyone?
How is this being rolled out in schools? You've mentioned a couple times there might be clinics after school hours. Are there going to be any distribution to students during the school day at all?
Not for the most part, no, because of the fact that parents want to be with their child when they're vaccinated, and that's not convenient for parents to come in during the school day if they're working. So we will have more evening appointments and weekend appointments. When families can come in, there may be some parents who might also not have had their first or second shot, so we will have adult shots available for them as well.
Can I ask, how much resistance do you anticipate from parents? This is the age group that obviously is going to cause the most concern. So have you some sense of how parents are likely to take this offer up?
We know that at least 50% of all of the parents of children in this age group are ready to have their child vaccinated right away. About 30% want to have more information, and that's why I think it's really important that we have these information channels available through Sick Kids so they can ask whatever questions they need to ask. Some may also call their pediatrician or family doctor as well, because we know that parents want to be careful and cautious with their children, but we do have this information widely available to them.
The phone lines now for the last question, unless anyone else Your question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Ministers. Thanks for taking our questions. I just wanted to ask about the age qualifications. The release says children must be turning 5 before the end of this year. What happens to kids next year who are turning 5? Do they have to wait until they're 5 in order to get vaccinated, or can they also be turning 5 next year?
So we're following the product monogram, and at this point it is 5-year-olds. So if your birth date is in that year, so not birthday, but your birth year, you qualify. And on the other end, the 12-year-olds, for the second shot, when we get to the 8 weeks, if you have hit 12 years old at that point, then you will get an adult dose for your second shot. Thanks.
Follow up?
Okay, thanks. So just to clarify, you can. So if my child is 4 in January 2022, but they're turning 5 in August, for instance, my child would be able to get vaccinated as early as January next year?
Yes, so it's done by the year. Correct.
Okay, thank you.
Can I just ask you, as regards that investigation, and I know there were text messages asking for financial information. Do you know if anyone had any money stolen?
To the best of my knowledge, no one has had any money stolen. Having said that, whenever anybody believes that there is phishing going on, or if they have been victimized by fraud, there is a fraud hotline. They can call their local OPP detachment or their local police, and I hope people do that. But to the best of my knowledge, no one has been defrauded through.